Welcome to TRU's Respiratory Therapy Program Information Session. This presentation will inform you of different options available to enter into our program, some of the courses we offer, and great opportunities that are part of this fantastic profession. A little bit of background, TRU is one of only 17 institutions across Canada where respiratory therapy is taught, and it's the only institution in BC. We currently accept 80 students into our first year, and we're the only program in Canada that accepts that many students into first year. The majority of our students do come to us with some post-secondary experience. Typically it's around at least 2 years of post-secondary sciences, and many of our students come to us already having completed a Bachelor of Science degree. So what does a respiratory therapist do? We work to assess, treat, and care for our patients of any age with cardiopulmonary disorders. Respiratory therapists are an important member of the healthcare team. Being an RT requires effective interpersonal skills, solid organizational skills. We are big problem solvers, and we have to be able to work independently and within the team environments. We also work in stressful environments. We work in all areas of the hospital. So we see a lot on our day-to-day, and it can be quite stressful at times. The following video will show you a respiratory therapist named Ryan Hughes, who works at St. Paul's Hospital. This video will highlight the skills required for respiratory therapists.
We take between 20 to 30 breaths per minute, nearly 40,000 breaths per day. Our next guest works hard for our lungs when we need it the most. Let's meet a respiratory therapist. Hi, I'm Viviana.
Hi, Ryan. Nice to meet you. Welcome to ICU. My name is Ryan Hughes. I'm a respiratory therapist at St. Paul's Hospital here in Vancouver. Our job is to assist in the diagnosis and treatment of cardiopulmonary problems. Some respiratory therapists work in diagnostics, doing pulmonary function testing, and work in a bronchoscopy suite. Some work in critical care, like I do, managing the breathing component of the patient's life support. It's a relatively new profession, and since then it's evolved to something that's much more clinical. So now we wear stethoscopes. We actually see patients. We are kind of much more part of the multidisciplinary team. In the morning, we come in at 7 o'clock and we will get handover from the night RTs that we're working. After that, we will go out and we'll actually assess our patients.
What's on your routine today?
Well, every 3 or 4 hours, we go in and we take a look at the patient's ventilator, check their blood work, look at their x-ray, and make any changes on the ventilator that we need to make. Let's go in and actually see the patient.
Okay, sure.
It's important that we organize our day. We're constantly building a workload based on things that need to be done right away, where we have clerical duties and we update our Cardex, which is basically an ongoing history of anything that's happened with the patient. Typically, we work 12-hour shifts. Generally, that's a mix of days and nights, 2 days followed by 2 nights, followed by a number of days off, 4 or 5 days off. There's quite a bit of opportunity for overtime in our department, just depending on the season. I graduated high school and then I did a biology degree at university, and then following that I went to respiratory therapy school, and respiratory therapy seemed to be a growing field, and it seemed very interesting. It seemed to be a place where the action always was. It's a 3-year program, so the first 2 years is in school, basically book work, and then the 3rd year is a full year clinical practicum. You can enter a program from high school. However, the majority of people would have university background.
So Ryan, tell me, where are we? What are we doing?
We're in the ICU right now. This is Jimmy. He actually came in earlier this morning with a flare-up of his emphysema. We're going to start him on some non-invasive ventilation to kind of help his breathing out.
Okay.
So let me just get it fitted here. Okay, head forward for me. and you should notice a difference pretty quickly when it starts working, okay? There's always new equipment, new techniques, new studies coming out that you have to stay on top of. But a lot of it does come down to self-motivated learning, reading. Some people take further education and become cardiovascular perfusionist or anesthesia assistant. There's also business avenues that can be explored. A lot of them are in the sale of nocturnal devices. We have to be really good with our hands, and we have to be able to troubleshoot equipment quickly. We're often called when the alarms start going off, and we run into the room and everybody's panicking, and it's our job to really, really quickly figure out what's going on and reconnect that piece of equipment that became disconnected. We do a lot of communication, obviously, in healthcare. Communication is key. We communicate almost continuously with other members of the multidisciplinary team, as well as patients and families. So it's important that we have those social skills. We do a lot of charting, obviously, being in healthcare. So it's important that your handwriting is legible and that you write things in an organized manner. Medical mistakes happening when there's not good communication. So it's something we all try to focus on, is making sure the communication is solid. I think the toughest part of the job is just dealing kind of with the stresses that we deal with on a day-to-day basis. The environment where we work is really full of tragedy, and you really have to figure a way to not take that home with you. I think the most rewarding aspect of the job is knowing that you're instrumental in helping the patient, and it's nice to see patients progress and get healthy, knowing that you're really instrumental in helping to drive that. If you're the type of person who obviously enjoys science, enjoys the idea of a career in healthcare, then the career would be for you.
Ryan, thank you so much. You have a wonderful job here.
Well, I sure had a great time showing you around today. Hopefully you learned something about being in our team.
You sure did.
Perfect.
Once again, I'm Viviana for Career Trek, reminding you that this career could be yours. See you next time.
So that video gave a great overview of respiratory therapy, and we have such a unique role within the hospital, within the community, within education and research. So within the hospital, RTs work all over. We work in critical care, which includes our ICU and emergency departments and our operating rooms. It also includes neonatal nurseries and pediatrics. We also work on our general wards, and we work in diagnostics at the hospital as well, so breathing tests and bronchoscopies. In the community, we also work in diagnostics with outpatients. We visit patients at home. Sometimes we help manage ventilators and artificial airways at home or assess people for their oxygen needs. And we work in tobacco cessation and pulmonary rehab, as well as in sleep hygiene or therapy assessments, so CPAP clinics. So I mentioned critical care in an ICU in the last slide, but post-graduation, when you're done our program, you have already had training in intensive care units and other critical care areas, such as the emergency room, post-op. A lot of cardiac and neurological surgeries we're involved in, specialty units such as a spinal unit and burn units, as well as I mentioned, the intensive care unit, not only for adults, but also for neonates and pediatric populations. So we are the only allied health profession that has its base curriculum and clinical practice in critical care medicine. A lot of other programs require you to have additional training to work in these areas of the hospital. And with that being said, there are some certifications that you may, depending on where you work and what your job requires, you may have to obtain. And those are just couple-day courses, including advanced cardiac life support, advanced trauma life support, pediatric advanced life support, and or neonatal resuscitation program. That's getting into the finite details, but just so you are aware, there is some additional certifications, but you are going to be trained in the critical care areas of the hospital during your practicum with us. We work in cardiopulmonary diagnostics, so we perform patient assessments both in the hospital, at clinics, at patients' houses. We also are skilled at X-ray interpretation. We work in pulmonary function testing or lung testing, so breathing test. And we learn how to interpret lab results as well as learn how to draw arterial blood samples. So this involves us using a needle to draw blood from an artery from a patient. We get the results and we're able to interpret those lab results and then adjust therapies accordingly based on those results. And then in the community, a lot of RTs work in the community, and this is expanding even more so. And these services include diagnostics, which includes spirometry, which is another breathing test. We assess patients for their oxygen needs. We're involved in palliative care. We help patients who are at home with artificial airways or ventilators. We help with their management. We also help with bronchial secretion management as well. So if patients need help with coughing or getting kind of that junk out of their airways, if they have weakened muscles, RTs will go and help them do this at home. We're also there for counseling for tobacco cessation, as well as pulmonary rehabilitation. Community respiratory therapists work with clients in their homes or at health centers or at doctors' offices, and they work to provide clinical support and self-management coaching to people with cardiopulmonary diseases. And this can include COPD or chronic obstructive pulmonary disease, asthma, and heart failure, among others. Where do respiratory therapists work? We work in acute care hospitals, like I've mentioned. We work in community health, and then also we work at colleges, universities, and educating universities, and we work in education at hospitals as well. So I've mentioned many of these, so I won't go through this list again. But among other things that are listed here, RTs are also involved in research for pharmaceutical companies, or initiatives that might improve healthcare and quality of life for our patients. And additionally, some respiratory therapists work in sales of medical equipment as well. So there's a whole bunch of different options and areas that respiratory therapists work. We don't strictly work only in the hospital. We work all over the place. What can you expect working as a respiratory therapist? This is something you will want to know before you enter into the program. Commonly, if you're working in an acute care or working in a hospital, we work 12-hour shifts. And if you are working more in a community care setting or a diagnostic setting, those shifts typically are 8 hours. Acute care, you would work typically 2 day shifts and 2 night shifts with a 4 or 5 days off in between if you are working in a full-time position. The starting wage for respiratory therapists is approximately $38 per hour in BC. And this varies across Canada, so definitely if you are from out of province and planning to train with us but then head back home, definitely check out what the wage is in your own province or the province you're intending to work in. If you have a degree, so if you have a bachelor's degree, and it doesn't have to be in science or health science, you earn approximately $100 more a month, just in recognition that you have a degree. There's lots of career opportunities. Hospitals are expanding. There's many hospitals in BC that are expanding or just finished their expansion. Here in Kamloops, Royal Inland just finished their expansion. They built a new tower that is now fully operational. Down in the Lower Mainland, St. Paul's is going to be moving to a new site, building a new hospital in the near future, as well as the Royal Columbian will be building a new tower as well. Beyond being an RT, there's training that you can take afterwards if you want to work in a different setting. So anesthesia assistants, many of them are respiratory therapists, and they do a postdoctoral diploma program, and I'll talk a little bit about that later. There's a lot of different careers available for somebody with a respiratory therapy diploma. We have 4 options at TRU to complete the respiratory therapy program. I'm going to go through all 4 of them and with a little bit of detail. I will be speaking about our clinical year on a slide further down to give a more specific overview of what clinical year looks like. We offer the diploma program, which is a 3-year program, and this is the most popular option. With it being 3 years in total, 2 of those years are didactic, so doing coursework at TRU in Kamloops, and then there's 1 year of clinical practicum. And just so you are aware, our clinical year, our clinical practicum is 47 weeks in duration. So it's like 3 semesters rather than 2 semesters. And like I said, we'll talk a little bit more about clinical in a later slide. Our intake for the first year of our diploma program is 80 students. The second option that's available is our dual credential program. The student graduates with a respiratory therapy diploma and a Bachelor of Health Science degree. This is a 4-year option. You would spend 3 years doing didactic learning at TRU in Kamloops and 1 year completing your clinical practicum. This stream has a limited number of seats, and when it's being offered, students apply to move into that dual credential stream by January of their first year at TRU. So you don't start the program in the dual credential. You start in the diploma program, and then if the dual credential program has seats available or is being offered, you would apply for that during your first year of the program. So it may or may not be offered on the year you start with us. I know that can be a bit frustrating if you're trying to achieve your Bachelor of Health Science along with the RT diploma, but the intake numbers for this stream are determined by how many seats we have available, and this is driven by the number of students that are entering into the clinical year and the provincial healthcare need for graduated respiratory therapists. With that being said, if the dual credential program is not being offered, or you do not get a seat, if there's limited number of seats and you're not successful in the application of getting a seat that year, that doesn't mean you can't achieve your Bachelor of Health Science. You could achieve your BHSC after completing the respiratory therapy diploma, and you would use credits from your diploma to put towards your Bachelor of Health Science and then take the electives after you've graduated with the diploma. And this would allow you to achieve that BHSC. You just wouldn't be able to complete it within those 3 years of the diploma program. You would do it post-graduation. Another option, which is also a very popular option, is our fast track stream. And this is a 2-year program, and it has limited seats. It's only available for domestic students and permanent residents only. It is not available for international students. It's very competitive, and there are specific requirements you would have to be able to apply to enter into the fast track program. And I'll go through those on the next slide of what specifically you need to have. If you are accepted as a fast track student into our program, you will be required to take 4 distance courses plus WMIS during the summer before entering into the second year. So you would be accepted. We would let you know we would tell you to start those 4 online courses, and those would need to be completed before you start in the program in September. You would then be on campus in Kamloops for 1 year before moving on to your clinical year. So when you're applying for the respiratory therapy program, make note that you're interested in the fast track program so you'll be assessed accordingly. If you are not successful in getting a fast track seat, we assess you then for a first year seat. Or if you don't meet all the requirements for a fast track seat, or you're unsuccessful at getting a seat, we do assess you then for a first year seat, and that may be offered. The final program option we have is the respiratory therapy and the Masters of Education stream. In order to enter into this stream, you must have a Bachelor of Science. This is not a very popular option because you're taking two separate programs that are running simultaneously. So there will be 2 tuitions for each semester, one for your respiratory therapy work and one for your Masters of Education courses. Plus, you'll have more work to complete. Our program is very intense, so this is why this option isn't very popular. The majority of our Masters of Education courses are offered via distance learning, so you can complete them online. We've had very, very few graduates completing the stream ever. It's just such a heavy workload that it's not very popular. So the admission requirements are listed here for our diploma and fast track options. Remember, you wouldn't apply for the dual credential until you've been accepted into the diploma program. With our diploma program, you are required to graduate grade 12 with a C+ minimum average. You have to complete Physics 11, Chemistry 12, Anatomy and Physiology 12, Foundations of Math 12 or Pre-Calculus 12, English 12 or English First Peoples 12. All of these you require to have a minimum of a C+ grade. With that being said, if you do meet those requirements, it doesn't guarantee you a seat as other ranking is taken into consideration, such as grade point average and post-secondary course completion as well. If you are a graduate from a foreign high school and or university, then you must meet the following English requirements before being granted admission into academic courses at TRU. So you have to either complete the TOEFL, English Language Proficiency Exam, or the IELTS, the International English Language Exam, or Duolingo is also being accepted. You'll note on the right is the fast track admission requirements. Because you're skipping the first year of the program, essentially, we require more, you have more requirements to be completed in order to be accepted. So you're required the same as the diploma. You need to have a grade 12 or an equivalent or a mature student status with those same requirements I just listed for the diploma stream. So that minimum of C+ grade. And we require completion of 27 or more post-secondary credits. 18 of those must be the following with a C+ minimum grade. You require 6 credits of Human A&P, 6 credits of English or Communications or Writing Intensive courses, 3 credits of Statistics, and 3 credits of Physics. So one thing to note for the Human and A&P or Human Anatomy and Physiology, we do not accept zoology credits. It has to be specifically Human Anatomy and Physiology to meet our requirements. So this is a visual for you to look at of our program, comparing those 3-year diploma stream to the 4-year dual credential stream. So no matter what stream you enter, whether it's the diploma or you apply for the dual credential, your last year is always your clinical year. So you start year 1. In year 1, you would apply to the dual credential program if it's available, and you would have year 2 and year 3 on campus in Kamloops, and you would finish with your clinical year. the diploma program, you would have your year 1 and year 2 on campus and then finish with your clinical year. So the first year of our respiratory therapy program, these are the courses you will be taking, and they're broken down into our fall and winter semester. Those asterisks that you see indicate courses that can be taken prior to coming into the respiratory therapy program. So many universities have human anatomy and physiology, statistics, physics, and English courses that can be used as credit at TRU. We do have students complete medical terminology prior to entering into the program, whether it's diploma or fast track. And our medical terminology course is a free online course that you can start after you're accepted into the program and finish during the summer. And more details about that will be given after a seat is offered on how and where to find that free medical terminology course. If you've taken medical terminology, you can let us know and that transfer credit can be applied. So if you're curious to see if you have courses, like if you've taken post-secondary courses that you think would grant you credit, you can go to BC Transfer Guide website and enter your course name and number from the institution you attended, and then select TRU as the to institution, and it'll show you if that course translates into any of those listed courses. Once you're accepted, and in order to give you we do official transfer credit assessments of your transcripts only after you've offered a seat and once a deposit has been made. So you may note it's a fairly heavy course load. You have 6 courses in a semester in your first year. If you do not have post-secondary experience, it can be a lot moving from grade 12 into our program just based on how intense it is. So sometimes having 1 or 2 years of sciences before applying can be beneficial, just to get a way of kind of university life, university courses. With that being said, we do accept grade 12 graduates, but not as many compared to the students we accept with post-secondary courses. This is the course load for our second year of our diploma program, and you'll note there's 6 courses per semester again, and some of these have labs associated with them. 4 of the 6 in each of the semesters have labs associated with them. All of these courses, you'll note, are specific to respiratory therapy. General Pathophysiology, Respiratory 2500, is the only one that has a distance online equivalent that can be taken through open learning at TRU. It is Health, or HLTH 2501. The courses that have the asterisks, you'll note there's 3 on each semester, indicate courses that would be taken in the second year if you were part of the dual credential stream. So we split this second year into 2 years if you're in the dual credential stream. So the remaining courses, the ones without the asterisks, would be taken in your third year of your Bachelor of Health Science degree stream, or the dual credential stream, and then you would finish your final year by going to clinical. And just a visual comparison of what I just said, so how many courses you're taking with the diploma compared to the dual credential stream. So in the second year diploma, you have 6 respiratory courses per semester. And then versus the second year of the degree credential, you take 3 respiratory courses per semester and 2 or 3 Bachelor of Health Science courses per semester. And that's the same as the third year. The Bachelor of Health Science courses are offered through TRU Open Learning, and some are available on campus to take as well. The RT diploma is still the entry requirement to work as a respiratory therapy in Canada. This may change in the future, but at present, In order to practice respiratory therapy, you are required to have a respiratory therapy diploma. Our fast track students enter directly into the second year of the RT diploma program as long as they successfully complete the 4 open learning or the distance courses prior to the beginning of the fall semester, so by September 1st. The distance courses that need to be completed for the fast track stream are listed here. These open learning courses are available to our fast track stream only. They can't be taken by a student entering into the diploma program. We require our first year students to take these courses on campus. For the fast track students, these courses must be successfully passed during the summer prior to entering the second year in September. Once our fast track students are on campus in September, we have extra labs for you to help, quote unquote, catch you up in regards to ventilation and the instrumentation labs, which are not part of the distance courses. So you're going to learn about equipment and ventilators and how to ventilate people in your online courses. And in order for that to really be solidified and kind of catch you up to where the first year students are, we hold extra labs to make sure you feel comfortable with the equipment and with the ventilators so that you're not behind your peers. So you'll note there's 5 courses listed here, one of which is WMIS. So that's your Workplace Hazardous Materials Information System. And then we have Respiratory 1781, which is an equipment course. We have RESP 1761, which is Cardiopulmonary Anatomy and Physiology and Introduction to Mechanical Ventilation. We also have the RT Medical Terminology. This is offered free, so this medical terminology course is free to you, and instructions on how to enroll and complete that course will be provided to you when you're offered a seat. And we also have HLTH, or Health 2511, which is Introduction to Respiratory Pharmacology. So all of these need to be completed prior to joining us in September. Our program is very hands-on. Our students practice many practical skills and procedures in lab. This includes human patient simulation, working with all sorts of equipment, and we do all this while you're on campus with us prior to you going to clinical. I want to note our program is not easy. You will need to be organized. You need to be staying on top of your class and lab work. If you feel like you're falling behind, you need to reach out for support as soon as possible. Faculty is very supportive. We want you guys to succeed in our program, and we're here to help you. You are in a smaller cohort in our program. You work very closely with your peers and the faculty, and you spend a lot of time together. There's also many supports available on campus for students to take advantage of, and this includes study skills, counseling, and our health clinic that's available as well. This video here is a quick look at lab life for our students in the respiratory therapy labs. So these are students that are finishing their last year on campus before going to their clinical practicums. So here is another video, and it shows our a respiratory therapy student's perspective on why they decided to go into respiratory therapy as their chosen profession. It was filmed during COVID times. As you know, they're all wearing masks in the lab.
TRU Respiratory Therapy Program. If you're into helping somebody breathe, this is the job for you. We're a valuable member of the healthcare team, and our students, when they're coming here, they're going to learn how to help people. They're going to learn how to work in the lab. They're going to get their hands on, and once they get out into clinical, they're going to work in a variety of different hospitals. Lots of job opportunities. We'd love to have you here.
So, why did you decide to join the RT program?
Well, for me, it's because I have a great love of science, and I really wanted a career where I could help people directly. And specifically RT, I love that it's acute care, and I thought that would be really exciting, and I would have an opportunity to help really sick patients, which I think would be great.
Yeah, sort of for me as well. Like I did an undergrad and I wasn't too sure what I wanted to do with it, and then this opportunity I learned more about what RTs do, and you're really in the hospital and you're kind of hands-on and you see a lot of different types of patients, which I thought was really interesting. So kind of a variety of the day-to-day, and yeah, I was just really excited to kind of be a part of it.
I also have a degree, and I also didn't know what I wanted to do. I know I wanted to do healthcare, but I know I didn't want to be a nurse, I didn't want to be a doctor, and then I wasn't sure what avenue to take, and then this opportunity came and was presented to me, and I shadowed, and I loved it, and like there's just always stuff going on, you're never just like sitting anywhere, or you're not sitting behind a computer or something, so I really like that, and you know, all over the hospital, you're not stuck somewhere. So I was really impressed with that, and then here I am.
Yeah, I would say pretty similar. I really like the bedside component, so you're interacting with a lot of patients, while still like working with ventilators, so machines. So I think just the variety of it really intrigued me.
Nice.
So clinical year is 47 weeks in length. So it's the equivalent of 3 semesters. Just so everyone is aware, you will be paying for 3 semesters of tuition while you're in clinical. Clinical runs from June, following your second year or third year, depending on what stream you're in, until April of the following year. It's broken into 2 levels. Level 1 runs from June to November, and level 2 runs from December to April. Your work during clinical year includes practical work, so working within the hospital and community and diagnostics, as well as some didactic coursework as well. During the year, you will spend 6 weeks in a neonatal or pediatric rotation at BC Children's Hospital, and this will occur either in your level 1 or level 2 rotation. There are multiple clinical sites that are affiliated with TRU and where you will be completing your level 1 and level 2 courses. Everyone will have clinical practicum at BC Women's and Children's for that neonatal and pediatric rotation. You will be at one clinical site during level 1 and a different site for your level 2. The choices for you are listed below. One of your sites has to be within the Lower Mainland list that I have there listed below, as well as one peripheral site. You could also pick 2 Lower Mainland sites. So at one point or another during your clinical, you will have to relocate down to the Lower Mainland. So in the Lower Mainland, we're affiliated with VGH or Vancouver General, St. Paul's, Royal Columbian, Surrey Memorial, Abbotsford Regional, and then also we have BC Children's that every student will attend for 6 weeks. The peripheral sites, so those that are outside the Lower Mainland, are the Royal Jubilee and Victoria General on Vancouver Island. We have Kelowna General Hospital, Royal Inland Hospital in Kamloops, and then the University Hospital of Northern BC in Prince George. How clinical rotations are decided, they're decided by random selection in the winter semester of your preclinical year. Typically, this occurs in February. A faculty member helps facilitate this and helps facilitate students picking their clinical sites. Not everyone gets the sites that they want. Sometimes decisions are based on expectations that students have voted on. So family, home, family responsibilities, and the students decide on these exceptions on somebody who would get a priority choice. So you may not get the exact rotation that you want for your level 1 and level 2 for your clinical practicum. I just want to let you know that all our sites are great. It can be frustrating and emotionally draining when you don't get those sites. You are only there for a short period of time, and then you are free to move wherever you would like. So even though it feels stressful and that it may be a big issue not getting a site that you really want, you will finish all the same, and you will meet incredible people working at whatever hospital you end up at. So with your clinical rotation, you are going to be responsible for finding accommodation during your clinical year. Many students share accommodations, so they'll split a lease because sometimes leases are held for a year and you may have to split that with a different group that's moving in while you move out. We hope to give you ample time so you know where you're going early enough so that you're able to find that accommodation. So once you've completed your practicum, your clinical year, you will graduate as long as you pass. But once you're done, you will be considered a graduated respiratory therapist. Once you've graduated, you're now eligible to write the registry exam. And that would denote you as a registered respiratory therapist when you successfully pass this exam. This designation of RRT is given by the Canadian Society of Respiratory Therapists after you successfully completed the HPTC credentialing exam. This exam is written twice a year, once in January and once in July. Our students, for the most part, write in July because you graduate in May. The cost to writing this exam is $900. Once you've written the exam and passed, you will then be an RRT. So, applying to our program, our application portal opens on October 1st and closes on February 1st. This February 1st deadline can be extended if we don't have a full cohort, so if we still have seats available. The application is online and transcripts can be submitted through the application portal. Remember, you can submit transcripts with courses that are currently in progress, but make sure that you update your transcripts once you've completed your courses. If you're applying for the Fast Track program, make sure to indicate that on your online application. Once you're accepted into the program, usually March to April, your transcripts will be assessed for transfer credit. We will not assess your transcripts prior to you being offered a seat and paying your deposit. That would require too much work, and we just don't have that capability. But remember, you can look at BC Transfer Guide website to see if your courses transfer to TRU credit. Once you're accepted, you're going to receive a lot of emails. You'll receive one from admissions, and you'll receive an email from our program assistant, Tara. And this will tell you what requirements are needed to be completed before you join us in September. This includes things like showing completion of a CPRC course with AED, your vaccination records, and a criminal record check, among other things. So what happens after you're an RT? There's lots of opportunities for us after we graduate, opportunities to continue education or move into different roles. So I described that you can complete your Bachelor of Health Science degree after you've completed your diploma. You can use the credits from your RT diploma to complete the BHSC through TRU Open Learning. You also, after you're practicing RT, you could further your education and become an anesthetic assistant. You also can become a cardiovascular perfusionist. These are options you can do after you've completed your respiratory therapy diploma. So the anesthesia assistant, or the AA program, is for graduates who want to work in the operating room or surgical units. The AA program is offered through TRU Open Learning and consists of courses and a practicum. So currently, an RRT applies for an AA position through their hospital they're working at, then takes the training. Sometimes this training can be subsidized through their employer. Anesthesia assistants work side by side with anesthetists and are proficient in airway management, respiratory equipment in the operating room, vascular access, and conscious sedation. Just a few of the things they become more proficient in as an AA. Another option of further education after becoming an RT is cardiovascular perfusion. This is a post-diploma program as well, and cardiovascular perfusionists run the heart-lung bypass machine during open heart surgery. This training is offered through BCIT in Vancouver. It's a 2-year program. You complete 1 year of coursework and 1 year in a clinical rotation. This program is also offered at the Michener Institute in Toronto, again a 2-year program, and as well as the University of Manitoba. Prerequisite for a cardiovascular perfusionist program is an RRT plus a Bachelor of Science or a Bachelor of Health Science plus clinical experience. So this, again, is a post-diploma program if you want to further your education and work as a cardiovascular perfusionist. But those give you an idea that RT isn't just RT. You can go further. You can do other things after you've gained your respiratory therapy diploma. So there's more information available at our website for our specific program. You can see it linked there. There's also the BC Society of Respiratory Therapy. They give you some education. They're our British Columbia Society, as well as the Canadian Society of Respiratory Therapy, the CSRT, has more information about respiratory therapy. If you have any questions, feel free to contact the RT Program Assistant Tara at resp@tru.ca, or you can contact the RT Academic Coordinator at respcoordinator@tru.ca. Tara should be able to answer majority of your questions, and if not, she does forward that along to the Academic Coordinator for further clarification if needed. Thank you for watching this program information session. Feel free to contact us with any questions.